Okay. How are you, everyone? So I have questions of NEET MDS 2024. I found the paper not tough. I guess everyone have attempted a high number of MCQs, which we tell from the beginning of the session. It was a 200 plus doable question, doable paper. Okay. Let me just cover the pedo and preventive questions which I have got. There still is there is one or two questions which are still unclear, and I am asking students with the exact language that we will see later. And once I get it, I will put it in the club also and put it in my uh, Facebook profile also. Let me just cover the questions one by one. The sequence for a crown placement after doing pulse therapy in primary, second, and first molar will be. चीज एक हम आपको मैंने क्लास में पहले भी बता रखी है. I have told you multiple times in chapters of pulse therapy, in chapters of SS crown also. We see lots and lots of cases where we are doing. Even today, I have done 2 root canals of D and E, like be it upper or be it lower. So whenever you do a root canal or a pulse therapy, or even if there is a chances of multi-surface caries in both D and E, you have to prepare both the teeth together, right? आप दोनों की do the crown preparation of both D and E after doing the pulse therapy or after removal of caries, or even if it's a Hall technique, whatever it is, even if it is a Hall technique, always the crown is placed E and then D. And remember that it should be done in one appointment only. It should be done in one visit. ठीक है, ये clear cut है, but क्यों है ना? Why we have to go with this? The simple reason being, when you see a SS crown, the crown has little bit of convexity, right? And when you give an SS crown in two teeth together, if the convexity happens like this, it will lead to problem in crown insertion. So we have to slightly reduce more both the proximal surface, which has a contact point at D and E, right? Along with that, we have to slightly compress, you can say flatten out. I have told you that crown pliers also, crimping plier, contouring plier, and able and socket, which is used to proximally flatten the crown, or even you can use a straight hoe. So once the crowns are flattened like this, one is this, rather than this and this, if you flatten the crown, it will seat properly, right? Both E and D are inserted, right? आपने insert किया, E लगाया, D लगाया, you have inserted, you have taken the X-ray. Once you are satisfied that the fit is fine, you will remove the crowns, slightly again recontour, slightly recrimp. Then you insert E first, and in the same appointment, the crown D is inserted. So in the question, you have to place simultaneously, right? And both the crowns are placed in same appointment with the second molar first and first molar after it. एक ही appointment में डालने, you don't have to place in different appointments. Single appointment, right? Single appointment, 2 crowns. That's it. It's not like you are placing E first, then you are recalling the patient, then you are doing D, right? Because it is quite, it is not practically impossible, right? But the advantage will be that once suppose if you have inserted E and later if you have to place a D, automatically while you place the E, you will not flatten the E part, the proximal part of E. You will slightly contour and crimp when you insert. And when there is a chance of placement of D, you will find trouble. Also, uh, we do such cases in which E was pearl therapy was done, E has been placed. We do a proximal filling of D, right? Because the parents were not okay in placing a crown D, right? And later, when the patient comes, because the filling break or there is a root canal treatment of D, we find it difficult to place D because already E is there, and we find it difficult to place D. But it is not impossible, but it is a bit more tiring to place D after the E is there in some previous appointment. So both, that's why convincing the parents, converting the parents to go for a better treatment at the beginning only, rather than making the child get a repeated treatment and getting a treatment done in a longer period of time. It's better to go for both the crowns in the same appointment, right? E first and then D, right? And you might ask, sir, why not place D first and E later in the same appointment? The reason being, the distal part is always covered first. If the child has a little bit of opening issue, then it may lead to more trouble. And why to go for that lengthy procedures? First distal part is covered and then mesial part is covered. It is similar to we go for less invasive treatment first and more invasive later. Similarly, first E and then D. Distal part is far treated first and then the mesial part, right? Next question, very easy. Which mineral if deficient in water can lead to cavities in children and adolescents? ये डेंटिस्ट्री में हमें पता है fluoride is a double S word. If it is more, lead to fluorosis. If it is less, lead to dental caries. So the ideal is 0.7 to 1.2 ppm depending upon the environmental area where the child is living. ठीक है? Okay, so very easy. The answer will be fluoride. इसमें टिक भी करने की जरूरत नहीं. The answer will be fluoride. Right? Let me see if I can put it here. Then there was great uploads. Okay, so the answer will be fluoride. Third question, Diagnodent is used for. Diagnodent is used to detect proximal caries. Diagnodent is used to detect proximal caries or occlusal caries. It can be used to detect all the type of caries, but it is mostly used to detect occlusal caries, right? It is a probing tip is there, right? Diode laser is used as a light source. 665 wavelength. आया कुछ यार? Diagonal. ठीक है, so it is used to diagnosis of the carious lesion. Diode laser is used as a light source. Important point इसमें ये था diode laser और दूसरा इसमें था it is mainly used to detect mainly. ठीक है, जैसे diphotite था for proximal, this is for visual caries. The most commonly occurring natal tooth तो बताएगा which is the most commonly occurring natal tooth. Mandibular center incisor, right? It generally comes in pairs, right? The treatment of such cases is the first priority is always to preserve, right? And the second extraction is only if feeding is impossible. Almost 85 to 90% of cases of natal teeth are of normal dentition. Only 5-10% cases are of superiority. So the priority is always to save them. Identify the space between the given image, lingual arch, unilateral or bilateral loss of multiple teeth. Unilateral or bilateral loss of multiple teeth. नेक्स्ट क्वेश्चन. ठीक है, अब क्लास में ये चीज आपको इतनी बारी बता रखी है, मेरे को ये हिस्ट्री पढ़ने की भी जरूरत नहीं है, हमें डायरेक्टली करना क्या था इसके अंदर, कोई बताएगा? ब्रूस वेन से बताया था. वेन हैज गिवन 3 टाइप ऑफ क्लासिफिकेशन: माइल्ड, moderate, severe or profound. Mild, isolated lingual caries. Moderate, isolated pinpoint caries on maxillary incisors and or molars. Moderate, lingual extension of caries. And severe is the tooth which are generally uninvolved. You can say that immune to dental caries are involved. Lower incisors with cavities हैं, तो ये क्या हो गया? Severe. खत्म. ठीक है, that's why I keep on telling in the classes that pediatric dentistry is the most easiest to score and most difficult to practice if you don't like the subject. And if you like the subject, there is nothing better than this. लोग जो दिन भर में 10 केस करके कमाते हैं, वो हम सिंगल केस में कमाते हैं, right? But you need to have that level of extreme patience. To transport an avulsed tooth, water is not used. पानी क्या होता है? देखो, जो avulsed tooth होता है, ठीक है, ये सारे most of the questions are such like you can just see the question, think in the mind what can be the answer and you can just match it. You don't have to use the rule of exclusion also, right? Avulsed tooth basically जो human body होती है, the human body has a pH of approximately 7.4 and the osmolarity is 320. The more the storage media matches it, the better the chances of tooth survival. What is treatment? Treatment for what? Iska? You asked me the treatment of which question you asked, I will provide you the treatment. Right? So water is basically hypotonic. We have studied that in our chemistry 11th, 12th class, right? So whenever the tooth is avulsed, the pedial cells, if you put that part into the water, the pedial cells are hyper, they have more chemical inside or material inside. Water has less chemical or material outside. So the water tries to go inside the cells, it keeps on going it will make the pedial cells swell, ultimately it will burst, right? So it is not, we can say, a better storage media. Water is hypotonic, it may lead to cell lysis because it makes the cell swollen and then lyse, right? So just for the sake of this, I will cover it. The better is via span, then HBSS, then milk, which is better is cold and low fat, then saline, saliva, then water. In fact, water is contraindicated. And you might see so many of other things. कोई आपका example देगा, they will give you example of treatment of severe ECC. Treat करना है, बताओ how you treat. कोई बोलेगा pomegranate juice. Some will say propolis, some will say different type of materials. They keep on studying it and they keep it publishing it. Then it will be trouble for us, right? The best practically is cold milk, गाय का, cow's milk, right? Because it has less fat. If that is not available, okay, buffalo's milk, भैंस का milk. That is the easily available. We don't find Viaspan or SPSS at our normal medical shops. Right? That was a question also, which is the most practical storage media. It is cold milk. बच्चा सीधे ECC का मैं एक चीज बताता हूँ आपको. Let me just cover it. When we used to do our post graduation 10, 12 years back, 13 years back, 14 years back, in 2010, 11 when we have started, we have seen very few cases where such type of damage we have seen. है ना, इतना damage हम rarely देखते थे when we were doing our PG. Especially post COVID, I see such cases, you can say every alternate day, because the dietary habits have changed. And I don't know why, might be because the teeth are not forming properly. There are multiple, it's actually a research issue. Lots and lots of cases there. Today also there was a kid who was 4-year-old and except lower 2 incisors, even laterals were not spared. Every tooth was carious. There were 4 teeth which we need to do pulp therapy. We have finished 2 today on one side because the child was having trouble by a couple of dentists. So we are doing it under nitrous and combo of oral sedation. So when the child visited us first, the child has so much of pain. That time the parents said that he is complaining of pain here. Right? Today they said the pain is here. And on phone they said that he is complaining of pain on the upper side. Actually, we cannot trust the child history of pain. We have taken the radiographs and we were sure that 4 teeth need pulp therapy and we will cover it one by one. That is the practical solution. The theoretical solution is you have to find the source of pain if you are not sure of the diagnosis. So the first treatment involves gross excavation and temporization with ZOE. ZOE acts as a mild sedative, so we just have to grossly excavate whatever teeth the child is complaining or the child is not complaining. We put a freshly mixed ZOE onto the teeth We try to send the patient, and later on the next visit when the child comes, we see which tooth is actually paining, because the sedative effect lead to a slight reduction in the pain of or which are you can say that reversible pulpitis type of teeth, and then we proceed with the treatment, right? So ultimately, it comes in the later of the first and foremost in the first visit, just normal routine checkup, X-rays, everything. If there is a pain, you can go for the gross excavation and not restoration, temporization की therapy, right? So that is the treatment of ECC. Ultimately, इस बच्चे के अंदर, if you can see the X-ray, the photograph also, the upper four anteriors, they say that the child age is 2 years, I guess, right? 2.5 years, है ना? 3 साल तक बच्चे के सारे ई नहीं आते हैं, है ना? तो ये फोटोग्राफ में एज या क्वेश्चन में एज में गड़बड़ है. दिस एज इज मस्ट बी एटलीस्ट 3 इयर्स. 2.5 साल के बच्चे में ई नहीं आते हैं. अगर आ भी गए हैं तो इतना डैमेज 6 मंथ्स टू 1 ईयर लगता है. ये बच्चे के 3-3.5 साल 3.5 इयर्स इसकी एज है, राइट? सो ultimately the 4 I will go for a root canal with post and zirconia, the flex crowns, or extraction giving the Grover appliance. Crowns जाएंगे, restoration होगी, बहुत कुछ होगा इसमें, ठीक है? And the skin needs regular checkup also, 1 month, 3 months, and every 6 months. Right? ये बता दिया आपको मैंने. 8-year-old boy presents with a pink pulsated growth observed in pulp chamber of a tooth. Routine examination, पिंक टूथ दे दिया, क्या है, ठीक है? तो ये पिंक टूथ ये बेसिकली पिंक ग्रोथ है ऑन द पल्प चैम्बर, है ना? ऐसे कुछ केसेस होते हैं जहां पे यू विल सी that there is red type of tissue completely covering that. ये क्या है? Because of slight irritation, it is known as chronic hyperplastic pulpitis. Where is the question? I think this question has troubled you a lot, right? एक कोई जबरदस्ती किसी बच्चे ने मुझे क्वेश्चन दिया था कि सर पिंक टूथ पूछा गया था. पिंक टूथ क्या होता है? पिंक टूथ इज बेसिकली कोई क्राउन पोर्शन में आपने कुछ ओस्टियोक्लास्टिक एक्टिविटी दिख गई है, वहां पे कुछ पिंक कलर का लीजन आ गया, जनरली इट इज सीन इन केस ऑफ ट्रॉमा, ठीक है? अगर क्राउन में है तो. अगर रूट में है, यू विल नॉट एबल टू सी इट रूटीनली. लकीली डायग्नोसिस में एक्सरे लिया, वहां कुछ दिख गया, है ना? पिंक टूथ में क्या होगा? हमेशा जो पल्प की जो इंटरनल आउटलाइन है वो चेंज होगी. एक्सटर्नल एब्जॉर्प्शन में आउटलाइन चेंज नहीं होती है, इंटरनल में कैनाल की आउटलाइन चेंज होती है. दिस क्वेश्चन वाज ऑफ chronic hyperplastic pulpitis. इसको पिंक टूथ मत बोलना. Because of slight irritation, the pulp proliferates. It doesn't happen in all cases. In few cases, it happens in which the immune power of a person is a bit low, right? Which of the following is yeah. Which of the following is not employed as a disclosing agent? Alizarin red is basically for growth study, calcium deposits को check करती है, ठीक है? These all three are disclosing agents. Erythrocin, methylene blue, gentian violet, right? This is basically used for growth, calcium deposits को check करती है, checks the calcium deposit growth. And the other agent are disclosing agent. Iodine, gentian violet, erythrocin, basic cushing, fast green, 2-diasterosin, and 2-tone disclosing agent. A travel kid bring a tooth in his hand within 10 minutes. What did you do? ठीक है? मैंने आपको क्लास में बता रखा है, कोडिंग क्लास वर्जन में the most important factor is time. The more sooner you replace, the longer are the chances of tooth survival, right? So within 10 minutes reimplant किया गया है, be the root is incomplete or complete, the chances of success is more, right? ऐसे कोई भी केस में आता है तो basically it's saying that 10 minutes में it is difficult to completely reimplant, but yes, you can say that within 15-20 minutes if the case has came, आप डायरेक्टली उस दाग को क्लीन करो, है ना, पानी से नहीं, better is saline, right? You irrigate it, clean the dirt, and you insert it, right? After insert, do the splinting. ठीक है? As soon as it is reimplanted, the more the chance of success, right? If the root is incomplete, then the splinting period is 1 to 2 weeks, and the root is complete, it generally is a 2 week type of 2 week of splinting period, right? And after 2 weeks, 3 weeks, 4 weeks, you can see that the root needs a root canal. Generally, it needs a root canal, right? So the immediate treatment will be clean the surface of tooth with saline and do reimplantation without any delay, right? If it is delayed more than 1 hour, go for a cleaning of tooth with the organic acid like citric acid to remove the PDL, dead PDL cells, and treat the tooth with a fluoride agent to reduce the osseous resorption, right? Child presents small and moderate size of cavities in upper anteriors which needs restoration. Okay, what will you go for to provide enhanced polarized release and to reduce the decay in future? Simple सी बात है, हम most commonly what we use glass enamel cements because it has fluoride, it provides fluoride. What is RNGIC? RN is basically resin modified GIC to provide additional strength. It basically provides additional flexural strength. The color or the color matching is also more better as compared to the routine GIC what we use. Okay, you can charge a bit more also for that. Right? So what are the advantage? They are modified by the inclusion of resin monomers. They were better aesthetic match, right? Good retention, long working time, provide protection from degradation. They are less sensitive to moisture, better fracture toughness, and increase wear resistance as compared to conventional GLCs. 2-year kid in the operatory, there were gaps, right? Barium issues देखते हैं. They were basically talking about which spaces? Primate space or anthropoid or senior space, mesial to maxillary canine, distal to mandibular canine. So कुछ नहीं करना है, बोला भैया कोई जरूरत नहीं है, ब्रेसेस नहीं देने हैं, क्राउन नहीं देने हैं, कुछ रिस्टोर नहीं करना है, बैटरी रीअश्योर करो भेज दो, ठीक है, but make sure you have taken the fees, right? कि कुछ किया ही नहीं, हमने फीस क्यों ली है? कुछ नहीं किया नहीं है, आपने 8 साल की पढ़ाई की है, 5 साल प्लस 3 साल उसके चार्ज करने बनते हैं, ठीक है? ये नहीं कि आप 10,000 चार्ज करो पर अपनी बेसिक कंसल्टेशन फीस ले लेना, ठीक है? ट्रायड था, ईस्ट ट्रायड की बात हो रही है, पोस्ट, सबस्ट्रेट एंड फ्लोरा, राइट? शुगर, दांत और म्यूटेंट्स. And the last question which I have got is this. There are 1 or 2 still controversial. I will take a bit more time to find a clear answer. This was the last question. When the accumulated dental needs in the population group is taken in a program and then there is a detection and correction of new increments of dental problem on a given basis, this type of dental care is known as. एक किताब थी जेम्स मोर्स डनिंग की प्रिंसिपल ऑफ डेंटल पब्लिक हेल्थ, काफी पुरानी किताब है. क्लियर कट लाइन टू लाइन वर्ड टू वर्ड वहां से उठाया गया है, ठीक है? इस क्वेश्चन में क्या है बता देता हूं मैं आपको. व्हाट इज इंक्रीमेंटेड डेंटल केयर? Accumulated dental needs in the population in a program. What is maintenance dental care? Detection and correction of new increments on a periodic basis. Now, when incremental and maintenance is combined, it becomes comprehensive dental care, which means combination of incremental dental care and maintenance of dental care. So, clear cut, a definition of maintenance care has been used to make an MCQ. Clear cut question, clear cut answer. Right? So this was basically the pedo part. Pedo, I have told you from the beginning only, except one or two questions you might find tough. Rest is very easy. Pedo preventive 15-20 questions. So there, I will still see if there are more questions. I will provide in the club because pedo is easiest subject to score, difficult to practice. If you don't like the subject, if you find it difficult, if you have a limited staff, if you have a limited equipments, limited armamentarium, only then it is difficult. Otherwise, pedo is the most money-earning branch in dentistry, right? People say implants and all that, they have some problems. Question number 13 again. प्राइड की स्प्रेड की बात हो रही है. फिर बाद में एक टेट्राड आ गया था. टेट्राड में इन लोगों ने टाइम ऐड कर दिया. कैविटी कैसे कॉज हुई? कैविटी इज कॉज्ड बाय combination of three factors: host, substrate and flora. Host is tooth, substrate is your sugar, and flora is basically mutants. Right? If still you have any trouble in any MCQ, you can mail me at Gaurav@damsdelhi.com. Right?